Welcome back in a new video session from Biology Boost Up. And in this new video lecture, we going to study about the heart sound. So now let's start. At first, the introduction of heart sound. When a stethoscope is placed on the chest over different regions of the heart, there are four basic heart sounds that can be heard. The sound waves responsible for heart sounds are generated by vibrations including by valve closure, abnormal valve opening, vibrations in the ventricular chambers, tensioning of the chordae tendineae, and by turbulent or abnormal blood flow across valves or between cardiac chambers. Now next, the first heart sound. The most fundamental heart sounds are the first and second heart sounds, usually abbreviated as S1 and S2. The S1 is caused by closure of mitral and tricuspid valve at the beginning of isovolumetric ventricular contraction. The S1 is normally slightly split because mitral valve closure precedes tricuspid valve closure. However, these short time intervals cannot normally be heard with a stethoscope, so only a single sound is perceived. Now next, the second heart sound. The second heart sound or S2 is caused by closure of aortic and pulmonic valves at the beginning of isovolumetric ventricular relaxation. The S2 is physiologically split because aortic valve closure normally precedes pulmonic valve closure. This splitting is not fixed duration. S2 splitting changes depending on respirations, body posture, and certain pathological conditions. Now next, the third heart sound. The third heart sound or S3 when audible occurs early in ventricular filling and may represent tensioning of the chordae tendineae and the arterioventricular ring, which is the connective tissue supporting the AV valve leaflets. This sound is normal in children, but when heard in adults, it is often associated with ventricular dilation as occurs in systolic ventricular failure. Now look at the fourth heart sound. The fourth heart sound or S4 when audible is caused by vibrations of the ventricular wall during atrial contraction. This sound is usually associated with a stiffened ventricle and therefore is heard in patients with ventricular hypertrophy, myocardial ischemia, or in older adults. In this video session, we also talking about the Fick'S law, the calculation, the equation of cardiac output, as well as a suitable example of Fick'S principle. So now let's start. The Fick'S principle. Fick'S principle is a straightforward application of the law of mass conservation. The amount of oxygen entering lungs by venous blood plus the amount of extracted from the breathed air has to be equal the amount of oxygen leaving lungs by arterial blood. Said alternatively, the difference between the amount of oxygen leaving lungs by arterial blood during 1 minute and the amount of entering lungs by venous blood during same time is equal the amount of oxygen extracted from the breathed air. Next, the calculation. If we have the following data, then we can easily calculate the cardiac output. First is amount of oxygen in arterial blood. Second is amount of oxygen in venous blood. And third, the amount of oxygen transfer from lungs to the blood per minute time. And this is the equation of cardiac output. Here, the consumption of oxygen upon the difference between arterial blood oxygen and the venous blood oxygen. Now let's talk about the example. Suppose 19 ml oxygen present in 100 ml arterial blood and 14 ml oxygen present in 100 ml of venous blood. So the difference of oxygen in arterial and venous blood is 14 ml. If the amount of oxygen absorbed by blood from lungs is 250 ml per minute, then the cardiac output will be the 250 into 100 divided by 5 equals to 5000 ml or 5 liter. Now let's talk about the stroke volume. The definition of stroke volume is the volume of blood pumped out of the left ventricle of the heart during each systolic cardiac contraction. This volume may be calculated as the difference between the left ventricular end diastolic volume and the left ventricular end systolic volume. The average stroke volume of a 70 kg male is 70 ml. Now next, the minute volume. The definition of minute volume is the volume of blood pumped out of the left ventricle of the heart per minute during each systolic cardiac contraction. Thanks for watching my video. Please like, share and subscribe the channel. Thank you friends.